Why on earth would they want to bring more positive patients into a nursing home that houses the most vulnerable part of society?
Sons and daughters are now worried about their parents in local nursing homes. More than half a dozen facilities in Mecklenburg County alone now have COVID-19 outbreaks. Those inside the homes cut off from their families for their own protection, but still helpless as they see cases surround them. And some of those cases include the people paid to take care of them. Now, after we pushed Mecklenburg County leaders, they released a list of 7 homes with confirmed outbreaks. And now we've learned positive patients are actually being moved to Huntersville Oaks. Channel 9's Aaron Edwards spoke to the son of a resident, now afraid for his dad's health.
Tom Williams says he just can't believe that Huntersville Oaks would choose to bring more coronavirus patients to a facility already filled with high-risk residents like his 93-year-old father.
I was unaware that there was any virus in the Huntersville Oaks facility.
Tom Williams' father is about to turn 94. He moved into Huntersville Oaks on February 29th.
So it's only, it's been 6 weeks.
Williams heard about the outbreak at the Atrium-owned facility from a friend who saw it on the news.
I immediately tried to contact them and couldn't get through to speak to anyone to verify it.
Later, he received an email from the facility saying there was an outbreak. But as surprising as that was, it's what came next that he couldn't believe. It said that Atrium would be relocating COVID-19 patients from other facilities to Huntersville Oaks.
I thought they had lost their minds.
Huntersville Oaks says it will keep the transported COVID-19 patients in a separate wing, but Williams says it's alarming.
It's unfathomable to me why you would bring, something that is known to be like the most virulent disease that known to man, and bring it into a nursing home that has residents there who are the most vulnerable segment of society.
Another part of the email that has Williams' concern is this line that reads, "To the extent possible, we have limited teammates from working in multiple areas of the building to prevent cross-contamination."
They did not say that they would definitively, have dedicated staff for the COVID wing.
After spending 3 hours trying to call the facility, Williams has yet to get answers. We also reached out to Atrium to ask about their decision to bring coronavirus patients to the nursing home. They said they could not answer those questions at this time. Atrium has not said where those patients will come from. In the letter, it just says other Atrium facilities. We'll, of course, continue to stay on top of this story and bring you the latest as we get it in. Back to you.
Well, these outbreaks are especially worrisome because our most vulnerable neighbors are at risk. Mecklenburg County says all 21 deaths reported in the county were people over 60 with underlying chronic illnesses. Even just catching the virus is serious for older people. 41% of those older than 60 with the virus end up in the hospital. These outbreaks are spreading quickly, too. The first case in a county long-term care facility came just earlier this month. The facility outbreaks are happening outside Mecklenburg County, too, with nearly 100 cases across the state. In our area, the state is reporting outbreaks at nursing home and residential care facilities in these counties. Well, you could be walking around right now with coronavirus and not even know it. We want to take you through 2 case studies that back up the need for social distancing and even wearing a mask in public. Both studies did mass testing on everyone in a group, whether they needed it or not. First, to a North Carolina prison, the News Correctional Institution in Goldsboro. We first reported Friday night that they tested every single inmate. Now, some tests aren't in yet, but so far, 259 inmates tested positive. And what's troubling about that, 98% of those inmates had no symptoms at all. Now, another wide-scale testing, this time in Boston. This was at the Pine Street Inn homeless shelter. 397 people were tested, 146 tested positive, but not a single person had any symptoms. So what does that tell us? In both of those places, hundreds of people had the virus and wouldn't have known it had they not been tested. Now, the CDC is looking into the Boston case because there's still so much we don't know about the virus. These studies were at a prison and a homeless shelter, so we don't know if there would be similar results from mass tests done on the general public. We also don't know if people with the virus who aren't showing any symptoms are as contagious as patients with active symptoms. But these are just some of the reasons that the CDC switched its stance to ask all people to wear masks in public and is encouraging social distancing. And that concern is also why governments and businesses are taking stronger measures on masks. In Durham, people are now required to wear a face mask anytime they'll be in public. This is part of the city's updated stay-at-home order. And even though the face coverings are required, no one will be told to leave stores or other public places if they don't have a face covering. The new rule goes into effect tomorrow. Also starting tomorrow, workers at Walmart have to wear a mask. Customers are also encouraged to do the same. Walmart said employees will be given a mask if they need one, or they can buy their own as long as it meets certain guidelines. Workers will also be required to pass a health screen and a temperature check. The coronavirus pandemic is putting our country's serious shortage of healthcare workers in the spotlight. Because of the virus, local nursing students are having a hard time getting the hands-on training that they need. Anchor Allison Lattes spoke with the head of UNC Charlotte School of Nursing, and she said because students can't train inside local hospitals, they're now turning to simulation.
It has been quite challenging because the agencies began prohibiting students. I was in early March. We certainly understand that they limited personal protective equipment. They don't want to have the students at risk. They have to focus on the job at hand. They all express their understanding of how important it is for our students to get into those clinical facilities to get hours. And then I go back to if we don't get the students through the program in a timely manner, and that's only going to add to the nursing shortage.
How are they feeling about entering a profession that, number one, is so needed, but secondly, can be dangerous too in terms of exposure?
It's stressful enough to be a brand new graduate and to enter into the workforce and not have a faculty member looking over your shoulder to make sure that you're doing everything the way that you should be. But it's quite another to take that level of anxiety, and then on top of that, you're entering into a pandemic, an unprecedented situation.
And she says 47 nursing students set to graduate in May will be able to apply for nurse graduate status with North Carolina's Board of Nursing. That allows them to work under the supervision of a registered nurse while they wait to take the state boards. North Carolina is now reporting more than 200 new cases of COVID-19 since Friday. Out of 76,000 completed tests, there are 6,100 confirmed cases. 164 people have died, and 24 of those deaths are in Mecklenburg County with 1,100 cases. In South Carolina, there are 4,200 cases and 119 deaths. 38,000 tests there have been completed. And one of the biggest issues about this virus is how long it's taken to get people tested. And now we're getting insight into why it took so long. Officials from the Food and Drug Administration tell CNN the problem is with how the CDC originally made the test. In mid-February, the CDC reported that the test was malfunctioning. By the end of the month, the FDA and the CDC figured out that one of the 3 pieces of that test had a design issue or might even possibly be contaminated. New tests were made and then shipped out. The Health and Human Services Inspector General expects to complete its review of the testing production by next year. Now, you might remember on March 11th, Governor Cooper said North Carolina received some test kits that were missing an extraction agent, and that was causing a delay in testing. We don't know yet if that's the part of the test that had those issues in production. Well, if you watched Channel 9 last night, you probably caught part of the historic One World Together at Home concert. It was broadcast live on ABC, NBC, and CBS and featured a lot of top musicians, all raising money for the fight against COVID-19. Overnight, organizers report that the concert led people to donate $127.9 million. Now that's spread among a response fund and local and regional responders. A South Carolina engineer and a boat maker teamed up to protect healthcare workers on the front lines. They're building these intubation boxes. The acrylic shields can protect our doctors and nurses during high-risk procedures, like placing or removing patient ventilators.
These boxes provide that protection at the most critical time that they need it. Every doctor that we keep in the fight is just has an exponential effect of more people that they're able to treat.
Now, the engineer said he wanted to give back to the medical workers who care for his son, who has a genetic disorder. They're sending the boxes to hospitals nationwide for free.